Hi, my name is Mike Hayden. I'm an orthopaedic wrist surgeon, and I'd like to talk to you about wrist replacement surgery. We're all familiar with hip and knee replacements that were developed in the 1960s, which have helped many patients. But over the last perhaps 10 to 15 years, the wrist replacement has been developed. Prior to this, the standard operation was a wrist fusion, which is still an extremely good operation, which will give a solid, pain-free wrist, but of course, with no movement. Patients often enjoy movement in the wrist, and this is where a wrist replacement can be of benefit. The ends of the bone, which are often arthritic, can be removed. In wrist replacement surgery, the ends of the bones are severely arthritic, and these can be removed and replaced with either a metal or a plastic component. This allows good, free, mobile movement to occur. The implants are inserted down the canals of the bone. Occasionally cement is performed, but often in the modern generation implants have got a special coating that allows the bone to grow onto the implant to cause a firm, bony ingrowth. The surgery is usually performed in specialist centres. Patients are kept in, perhaps overnight, as the hand can swell after the surgery. Within a few days, the temporary cast is removed and the patient is seen by a hand therapist. A static splint is applied, but we often get patients with a wrist replacement moving within the first week. The stitches are removed between 10 and 14 days' time. The swelling usually subsides over the first 3 to 4 weeks, and patients are starting to realise benefit between 4 and 6 weeks after surgery. Wrist replacement surgery is not without its risks. The 90 to 95% success rate that we can perform with hip and knee replacements is not the same as with wrist replacements. And I think it's important that the patients, before having a wrist replacement, discuss this with their surgeon, understand that their surgery is competent at performing such surgery, and understands the expected outcome. Patients undergoing wrist replacement surgery often have got rheumatoid arthritis. Fortunately, with increased advances over the last 5 years or so with rheumatoid arthritis, the need for wrist replacements is perhaps decreasing in rheumatoid arthritis. But we are seeing a subset of patients, particularly those with osteoarthritis, who are now starting to enjoy wrist replacement surgery. However, wrist replacement surgery is technically quite difficult. It's important that you have a surgeon who's well versed with all the techniques and the complications associated with this procedure. Common risks include dislocation. The wrist replacement is a two-piece component, and if the balancing isn't performed adequately, the two components can disarticulate. There are also associated fractures of the bones. Tendons and blood vessels and nerves can be injured. But one of the complications is also stiffness. And whilst patients have undergone a wrist replacement to improve their range of movement, unfortunately, occasionally patients can become stiff.